So we're presenting our collaboration with UCSD, and this is a prospectively collected data set, retrospectively analyzed. At this point, this is an interim analysis. We'll still be recruiting patients and presenting more data in the future. These patients all have advanced cancers, stages 3 and 4, and they're treated with immunotherapy, either single-line immunotherapy or combination immunotherapy treatments. And what we're looking to see is the correlation between ctDNA dynamics and the outcomes of treatments in these advanced cancer patients. Wonderfully, what we saw is that patients who achieved a molecular complete response, which we defined as clearance of ctDNA, those patients did extremely well. We're seeing 100% overall survival at year 1, compared to patients who did not achieve a molecular complete response. They had a 52% overall survival at year 1. The next group that we want to focus on are patients who had an early molecular response. Early molecular response in this study was defined as a 50% or greater decrease between time point 1 and about 23 days later. So if the ctDNA went down 50%, what's happening with those patients? We're seeing that patients who had a molecular response are achieving also much better progression-free survival compared to patients who does not achieve an early molecular response. And if you even look further at a smaller cohort of patients who achieved a stable disease, you can see that you can split them out by ctDNA, with patients who are having a molecular response having an 88% progression-free survival rate at 1 year versus those who did not achieve a molecular response but still had stable disease. Those patients only had a 13% progression-free survival rate at year 1. So interesting to look at how molecular response and ctDNA assessments can complement already existing ways of triaging patients. Finally, we want to focus on the fact that our assay is achieving ultra-sensitive detection. And in this group of advanced patients, 33% of detections were in the ultra-sensitive range, under 100 parts per million. That is what's really letting us achieve these results in overall survival, in progression-free survival, and also in lead time. So the last data set I want to focus on is the lead time between progression being caught on ctDNA and on imaging. We see that we had a few patients who were caught in progression on ctDNA, then on imaging. The lead time there is 152 days. There was only one patient who had basically a few days apart the imaging caught the progression as well. And this is very meaningful because this is showing how in tracking our patients, we can be ready for what's to come next.